and welcome to this webinar on risk management. As usual, please mute and turn off your video until we get to the Q&A session. You can ask questions at any time in the chat box. During the Q&A session, if you want to ask by voice, just unmute and ask when you're invited to speak. As always, the slide deck will be shared with you. Today, our presentation is in two parts. I speak for about 30 minutes, then we have the first Q&A session, then you get a second session of presentations, and then we have the second and slightly longer Q&A session. But anytime, please type your questions in the chat box. Please mute and turn off your video because it saves bandwidth if the video is off. I think by now you all know who I am, so we can skip over that. I think the point about risk management is people think it's something entirely new in the supply chain. It isn't. Risk management has been part of the supply chain and the health supply chain for at least 2,000 years. You can find it in the records of the Roman army when they talk about medical supplies and risk management. You can find it in the papyri of Egypt, the ancient scripts in hieroglyphics from Cleopatra's time, talking about risk management. And you can find it in more recent times, managing drug supply, now more than 40 years old, and the logistics handbook, all talking about risk management. It's not new. Problem around risk management is there's lots of misconceptions and misinformation. People will say we've always had risk and there's nothing we can do about it. And anyway, this risk management, just look at those formula on the screen. It's far too complicated for us. We can't do that. We don't even know what data analytics means, let alone be able to use it for risk management. And we don't have any data. The bit of data we've got, it's not reliable anyway. We can't do risk management. That's a lot of the misinformation and the myths. Yes, you can do risk management. It's not that difficult, it's not that complicated, but it is a management process. And you have to approach it as a management process. So basic, effective, low-cost risk management for health procurement and supply chain are well established. You'll find the USA document on the screen describes it in detail, how to do risk management for health supply chains. You do not need to go and study an MBA, although if you've got one, that's fine. You don't need to be a management theory expert. You don't need to be a big data whiz kid. You don't need to be a computer expert. You don't need massive resources and massive funding to implement them. And risk management techniques work, and they bring benefits, reduce cost, reduce morbidity, reduce mortality. The key message is risk management works and you can do it. It's not all that difficult. Why are we doing risk management now? We've been doing the supply chain for 50 years. Why have we all got to go risk management now? Well, we've always needed risk management, and some elements you've already been doing. You already have buffer stock. That's an element of risk management. What we're doing in risk management is formalizing and taking a total systems approach. But COVID really has brought home the need for risk management. We were not ready for COVID. It was a disaster. It's brought home, we cannot continue to ignore risk management. We have to get ready. We can't have another COVID situation. COVID should not have been that serious impact on the supply chain. It was because we've allowed our supply chains to become so fragile, so delicate, because we've not been applying risk management techniques. For more than a generation, for more than 30 years, We've gone to cost reduction, cost reduction, cost reduction, without looking at the consequences. Those consequences are very fragile supply systems, and that's what we have now. Implementing risk management is going to be a challenge. You'll hear people say all the time, we're too busy, we can't do it. We're only just managing the supplies we've got. We can't take time to go and study all this. Wrong approach. If you don't apply risk management, you're always going to be in a crisis. There are always going to be issues. You have to do it. Emergencies are becoming more frequent. Stockouts are becoming more frequent. The global supply chain has been disrupted. Climate change is causing more disruptions, more flooding, more natural disasters. Risk management is little known. People don't understand it. So you're going to have to explain and advocate to people who don't want to listen why risk management is so important, why you have to have it, why you have to do it. Let's start by trying to define risk and risk management. So risk is defined as the probability an event will occur and the consequences. An event, an earthquake. What's the probability of an earthquake? And if it happens, what's the consequences? Dire. So there's lots of different risks and there's lots of different consequences. If there's a disruption to the aspirin supply chain, quite probable, the consequences aren't very high. If I'm out of stock of aspirin for a few days, it's not really important. If I've got an earthquake, I've got a huge extra demand for all my health commodities. It's got a lot of consequences. So risk is a combination of the probability, the chance an adverse event will happen, multiplied by the consequences of an adverse reaction. Risk management is a formal approach to identify the risks and mitigate the risks. I can't always stop the risks. I can't stop a volcano or an earthquake or a flood, but I can be ready. So if they occur, it's not such a massive disruption. I can mitigate the consequences. Sometimes I can reduce the risk. I can prevent it. But often for natural disasters, I can't do anything about the risk, but I can be ready when it happens and reduce the consequences. And you'll find that formal approach in the USA document, Risk Management for Public Health Supply Chains. The point here, it's a formal approach. You've already been doing some elements of risk management like buffer stock. Now we have to formalize the whole process into this risk management approach. Point around this is I need a formal approach. And the formal approach is defined by ISO 31000. Not just any old risk management. I'm going to follow the ISO standard. And that's really important. So throughout all of our course, we refer to the WHO guidance and the ISO standards of risk management. If I don't apply the ISO standards of risk management, I'm not likely to get donor funding. They need to know I'm doing risk management to an approved standard. And that standard is generally taken as ISO 31000. There are many risks in the supply chain. There's all sorts of things can happen. International shipment, the plane can crash, the ship might sink. There can be problems unloading at the port. There can be a crash, all kinds of threats. The supplier might go bankrupt. There's a problem on the carriage. They lose the goods. It gets lost. It gets stolen. All kinds of risks come together all throughout the whole of the supply chain. And that's why I need a total systems approach. There are risks everywhere in the supply chain, and I have to try and identify and mitigate those risks. Well, why do we need this risk management? We've been doing supply chain for more than 30 years. We've never used this risk management before. Well, you've used some elements of it before. The point is around that. We look at the disruptions from the supply chain. 85% of supply chains have had disruption last year. Last year was after COVID. We're still having disruptions to the supply chain. And one area that people are not considering at all in the public sector is the digital risk. What would happen if you got a virus infection and all your stock data got wiped out? What would happen if all your procurement data got wiped out? How would that affect you? So there are digital, cyber risks, as well as the physical risks to theft and problems of distribution, trucks breaking down, all sorts of other issues. We need to pay more attention to the cyber, to the digital risks that we have, because the majority of public sector supply chains has no preparation for cyber risks at all. In the private sector, it's not very good either, but it is better than the public sector. We have to look at the physical risk and digital cyber risks. We look at the example in COVID. Yeah, can we ask everyone to mute, please? Yeah, good. If we look at the kind of disruptions we got in COVID, airfares increased by 500%. Massive delays. Even when I got the supplies, I produced the supplies, I got them ready, I couldn't deliver them. I couldn't get them to low-income countries. I couldn't get them to Africa and the Caribbean and Southeast Asia. I couldn't get them there. There were export restrictions, all kinds of disruptions to the supply chain. Bear in mind, those disruptions cost lives. If I don't have those materials, people die. That's the impact of these massive disruptions on the healthcare supply chain. We've seen all kinds of impact on the supply chain disruptions during COVID. 73 countries were out of stock of ARVs, life-saving medicines. What happens to patients who don't get ARVs? They die. That's the reality. We've had this disruption. Our supply chain was a complete mess. And even now, after COVID, we've got global funds saying there are delays of 3 to 4 months. Already the lead times are long for ARVs and TB medicines. And now there's an extra 3 or 4 months delay because we have allowed our supply chains to become very fragile. We've not used a risk management approach to bring those forward. We look at Global Fund, 23% of orders are delayed more than 30 days. Even now, a year after COVID, we've still got delays on products going in. Of course, COVID products are still in short supply, but other pharmaceuticals are in short supply as well. Long-lasting insecticide nets for malaria. It's nothing to do with COVID. They're in short supply and have long delivery times. We didn't plan. We didn't look at risk management on our system. So the trend has been, for the last 30 years, reduce the cost of the supply chain, cut back the number of staff, buy from the cheapest possible source, which generally meant India and the Far East, China. But in doing that, this globalization of the supply chain, this going to the cheapest possible source, has made our supply chains vulnerable and complex. We often see items transshipped 4 or 5 times before they come to us. We see other products where we have no control. We have a trend towards just in time. The manufacturers don't keep any stock. The distributor suppliers don't keep any stock. Every time we place an order, they have to start from fresh. That might be very cost saving, but it's not efficient and it's not effective. And we've got fewer and fewer suppliers. Before, we used to have 30 or 40 suppliers for antibiotics. Now, something like 90% of countries only buy from 3 or 4 suppliers. The whole of our supply chain has become very fragile. It's made it very low cost, but it's made it fragile, easily disrupted, easily upset. And that's why we need, much more now than we did in the past, risk management. Before January of 2020, I wonder if you'd ever even heard of the city of Wuhan and Hubei province in China. Now you know it as the place where COVID was first identified. But what many people still don't know is Wuhan is the center of API manufacturing, active pharmaceutical ingredient. Most low-income countries buy their products from India, but India gets the API to make the pharmaceutical products from China. And where in China? From the city of Wuhan in Hubei province. Around 70% of the APIs for India all come from Hubei province, city of Wuhan in China. So when they had a lockdown, the whole global supply was disrupted. We had a 90% dependence on the API from China. That's how fragile. We didn't even realize it. People didn't know about it. All we know is, oh, procurement places the orders on India. Didn't know anything about the API coming from China because people didn't look at the risk, didn't measure the risk on the global supply chain. There are currently 100 drugs worldwide in short supply because of disruptions, because we've allowed the supply chain to become so fragile, so centered on just a few suppliers. Well, which supply chains were ready for COVID? In fact, 10% said they had no planning. Around half said they had some planning, and only 17% said they were ready. And I have to doubt even 17%. Majority of countries weren't ready at all for any kind of disruption. Right now, 40%, 39% said they're now prepared. I don't believe it. I don't believe they are prepared. They may be a little bit better, but not much. They've still not measured the risk of a supply chain disruption.
Hello.
Yeah, please mute.
Okay. Blandino.
Global Fund estimates supplies delays of 3 to 4 months. Right now, COVID is over, but you still need personal protective equipment, PPE. Do you have strategic stocks? What would happen if there was a second outbreak of a new COVID variation? Have you got enough PPE? Have you got extra stocks now? Are you prepared? 50% of countries are not even partially prepared. We haven't learned anything from COVID. We're not using risk management to estimate the crisis and to plan for the crisis. Now, the point around this is supply chain risk management is not just pandemic planning. That's just highlighted the problems. There are many risks in normal healthcare. We need to manage those risks all the time. We had risks before COVID and we've got risks after COVID. COVID just highlighted all the risks that we've got. A key feature of risk management is to prevent problems. If we apply risk management, we can prevent many problems. Risk management is across all industries, all kinds of supply chain, whether it's spark plugs for cars or tires, or whether it's health. But in health, it's a much greater risk. When we're out of stock, people die. We saw massive disruption due to COVID. Point around this is we have to link together supply chain management and risk management. And it's a particular problem because low and middle income countries have a low buying power. Compared to the other countries, we don't have a lot of procurement clout. We're always back of the queue when it comes to getting short supply commodities. So we have to be especially prepared. Otherwise, the high-income countries will just buy everything up and there's nothing left for us again. We have to look at that risk management for our environment, for our particular circumstances of low buying power. What does all this mean? I have to bring together risk management and supply chain management to form supply chain risk management. Two are entirely interlinked. Two come together. Point around this is I can't just do a little bit of risk management. It has to be a total system approach across all aspects of the procurement and supply chain management. Every part of it. If I just do buffer stock on its own, it doesn't work. I have to look at all aspects of supply chain risk management. Well, what's involved in this risk management? And we follow the ISO system. And the first one is we identify the risks. What risks have I got? What are the sources of the risks? What are the impacts of the risk? How serious is it going to be? Then I analyze the risk. What's the chance of that risk occurring? What are the consequences of that risk? And what's the overall level of the risk? And I do that by combining the chances of it occurring, the probability, with the consequences. And then I evaluate the risk. Then I've got to either accept the risk. Earthquake, volcano, I can't do anything about. But some risk I can reduce. Other risks I have to be prepared to mitigate the impact. So I can't affect the risk itself, natural disasters, but I can be ready when it happens. So, country of Indonesia has 523 district medical stores. Every month, one disappears. Earthquake, mudslide, volcano, tsunami, because Indonesia is a geologically active area. It gets a lot of volcanoes and earthquakes. Can't do anything about that. But I can be ready. So if a medical store is destroyed, I can replace it. In Indonesia, within 2 to 3 days, I have a replacement of stock, of materials, of supplies that I can use. Bang, right there. That's their mitigation strategy already. Because they have a high rate of loss. Because it's a geologically active area. Other areas are not geologically active. Some countries never have a volcano, never have an earthquake. But there are other ways. There's fire, theft, floods can destroy, but disruption to the supply chain itself can be a disruption. And I can mitigate, I can reduce the impact of the risk. So 2 parts, reduce the risk if I can, reduce the impact of the risk, and I can always do that. How do we start on risk management? Start with a clear idea of what you want to do in risk management. Are you going to proactively manage the risk or just respond to unforeseen events? And I suggest you must manage the risk. Use a risk management approach for all operations, starting at product selection, all the way through forecasting, quantification, procurement, sourcing, QA, inventory, pharmacovigilance, and computer data security. Be prepared. Recognize the role of resilience, not just pandemics, although we need to be ready for them and disasters, but all the time improving the resilience of my supply chain by identifying the risks. It's not going to be easy. Often they'll tell you, we don't want all this risk management. Oh, it's too much trouble. It's too much problem. We don't want to do it. You're going to have to advocate. You're going to have to explain to people who don't really want to listen to you why you need this risk management. Because if we don't, we're going to be in another COVID situation soon, where we are failing to supply and people are dying. We have to bring that through. We have to advocate and push for risk management. Well, COVID was just a one-off. We're never going to get a COVID again. And we call this kind of event, which is a one-off event, a black swan. Because most swans are white, so it's very rare that we get a black swan. They call it a black swan event. COVID was not. We've had epidemics, we've pandemics before COVID. COVID was more serious, but we've had them before. We've had Ebola, we've had SARS and MERS, even the HIV epidemic. We've had them before, and we didn't learn anything. We didn't get ready for the future. We didn't improve resilience. We need to get this idea of the black swan out. COVID was not unique. Things of what could happen before then. 10 years, most countries made an influenza pandemic plan. Had they have implemented it, they were ready for COVID. Only 4 countries at the world implemented their pandemic plan. They all made a plan, but they didn't implement it. We have to learn and use risk management to guide us in the future. And to do that, we're going to use the ISO 31000 risk management process. Identify the risk, analyze the risk, evaluate the risk, and treat the risk. That's the process we go through. Using ISO, it will be recognized as a quality management operation. Why do we need to use ISO 31000? Because that will bring us donor funding. They will support us if our risk management is to an approved standard. If we just say, oh, I'm doing risk management, people aren't really going to take much notice. So it brings recognition, management and financial recognition, and not just among the donors, among your own ministries, Ministry of Finance and Ministry of Health as well. And it brings stakeholder confidence that you really know what you're doing and that you're operating to recognize global standards. So for this part, risk management is a long, and we've got to try and bring it to the forefront of healthcare operations. COVID pandemic and its impacts has highlighted the need for it. We absolutely have to have it. ISO 31000 provides the international standards to guide us through the process. Healthcare is a little different to standard risk management because lives are at risk. And risk management is as much about preventing problems as it is about crisis management. It's not all disaster preparedness, it's preventing everyday problems as well. Okay, our first Q&A session. Do we have anything in the chat box on questions and answers? If you have any questions, we have 10 minutes now. Okay, got a question just come up. Okay. Can we integrate PSM risk mitigation plan into National Disaster Reduction DRR plan? How about costed plans for interventions such as pre-position? People still think it's a waste of resources. Okay. Yes, the PSM risk management plan should be into the national plan. Pre-position of commodity, absolutely essential. If we learnt anything from COVID, surely that was it. If you don't have PPE where it's needed, it's not going to happen. And international agencies do it. Where does International Red Cross keep their supplies? In Geneva. They have 6 depots around the world where that happens. Look at the other international relief agencies. They have regional depots as well where they keep the supplies. So pre-positioning supplies is there. We do have to be aware of cost. We'll talk a bit more about cost a little bit in part 2 of this presentation. Any questions? Please unmute and ask your question or type it into the chat box. Can just unmute and ask a question if you want.
Yes,
Otherwise,
Prof.
yeah, go ahead, please.
My question was, you made mention that more than 100 drugs are still in shortage while COVID has been contained and the systems are back to normal. So why is it so?
Because the supply chain has been disrupted. Look at how a drug is made. You have to obtain the materials from the API, the active pharmaceutical ingredient. The main source for that is China. So China is still disrupted. The problem is still they're not producing as much API as they did in the past. So even in India, where they buy the API from China and then make the finished product, they can't get enough API. There's problems even around silly things like gelatin capsules. You can't get enough gelatin capsules to encapsulate the medicines. There's problems around glass bottles. Issues on COVID vaccine, there weren't enough glass vials to fill the vaccine. You've got the vaccine. So silly things like this are disrupting the whole of the supply chain. It's a real problem issue.
All right, thank you, Prof.
Yeah. Anyone else, please unmute. Don't be shy, please unmute. You're among friends and family here. You can unmute and ask your question, or if you want, just type it into the chat box. Okay, then perhaps I'll go ahead with part 2 of the presentation, and we'll have a longer Q&A session at the end. Okay, so part 2, the basics of risk management. Part about why we need risk management. Part 2, how do we actually do it? And the point about risk management is to get a balanced approach. And that's important because after COVID, everyone's clamoring for more resilience. And yes, we do need resilience, but we need to keep a balance between efficiency and resilience. We've gone too far to efficiency during the last 30 years, cost cutting and cost cutting and cost cutting. And that's reduced the resilience of the supply chain. We have to bring it back towards resilience, but not too far, to keep some of that efficiency. So the point here is a balance. And that's important to stress because everyone is clamoring for resilience. And we have to just moderate that with keeping a balance between efficiency and resilience. And we do that using management approach. Basically, if I increase the efficiency, I reduce the resilience. If I increase the resilience, I reduce the efficiency. The two are equal seesaw. As I increase one, it reduces the other. So that's a problem, to get efficiency and resilience together. There's no simple way. I have to try and meet a balance. And there are trade-offs between the two. And the point around this is, I've often taken the whole of my supply chain as one item. It isn't. I've got around 350, 400. I have around 3,000 health products. I could have a different approach according to different products. For my paracetamol, does it matter if I'm out of stock for a few days? No one is going to die. Move towards more efficiency. For antiretrovirals and TB medicines, people die if I'm out of stock. So I need to move those towards more resilience. And I do that using the Venn system. Point efficiency, resilient, balance. I also around on the Venn system, vital, around probably 50 to 90 items, which are in the V category. Those must be resilient. I must have good buffer stocks. I must have backups all throughout the operation. But other items, I can have greater efficiency, less resilient. The point is, make the balance according to the nature of the item. Not one size fits all. Not just resilience. I don't need to keep 2 years buffer stock of paracetamol. Nonsense. I might need to keep 6 to 9 months of ARVs and TB medicines. Look at the individual item, balance the efficiency and resilience. And again, the key is for balance. All this clamour for more resilience when I need balance. Especially post-COVID, everyone is publishing papers, everyone is advocating we must more resilience, more resilience. They would have you keeping 4 years buffer stock on an item that's got a shelf life of 2 years. It's nonsense. Yes, I need more resilience, but balance with efficiency. Not totally go the opposite way to resilience. If I look at the classic approach of what I want fast, cheap, and good. But I can never have that. I can only ever have 2 out of 3. Excuse me a moment. Okay. I have it fast and cheap, but it's not good. I can have good quality, but it's not cheap. I can never achieve the classic approach. But actually, that's not what I need. Might be what I say I want, but it's not what I need. I don't need fast. I need agile, timely, reliable. If it's reliable, I can plan. I don't need cheap. I need cost effective. Not the lowest commodity price, but the lowest total cost, TCO. Cost of having secure and reliable suppliers over the longer term. I don't want good, I want assured quality. Brand names are good. I don't need brand names. I can have assured quality generics. So if I change my approach from this fast, cheap, good into a balanced approach where I have agile, effective, and assured quality, I can achieve all of those 3. Balance that I need to do. And we get this approach from risk management. We strive for balance. Don't go to try to move towards the absolute. I want procurement responses in 48 hours. You're not going to achieve. It's not going to be cheap and it's not going to be good if you get that. So agile, cost-effective, assured quality, a balanced approach. How we try to measure or estimate the risk. And it's in 2 parts. We have qualitative, and generally we do that by expert opinion using the Delphic method, rating the risks into broad categories. We have quantitative, where I can actually measure the risk against a numeric value. Fortunately, in public health supply chains, we rarely have reliable enough data for quantitative analysis. Even if the data was available, the calculations are far too complicated for general PSM use. We have to try and use the Delphic method and much more simplistic method. On the bottom of the screen, you can see a quantitative assessment case study. You can see the type of formula. If you're happy using that kind of formula, then go ahead with a quantitative method. For most of us in the PSM, it's too complicated. And we're going to use a much simpler system. We're going to use the KISS simple, keep it simple from the start. And system, we can do that. We can make it happen effectively, low cost, and bring real benefits. We don't need these complex equations. So in this qualitative approach, I'm going to measure the risk. When I use rating scales, using a risk matrix. And I'm going to bring a quantitative approach from the qualitative approach. So understand there's always risks in PS. There's no such thing as zero risk, and it's impossible to mitigate every single risk. We've got to accept some degree of risk. So risk mitigation has to be cost effective and practical. So the question you asked me just before the Q&A session in the chat box was to place forward stocks, to place contingency stocks ready. Yes, it often is, but we need to do the calculation. Is it cost effective? Is it cost effective to keep 4 years buffer stock? Absolutely not. There are other ways to manage it. I don't need to do that. I can use a risk management approach to bring a balance to the operation. Good risk management needs quality data, and many of our systems we just don't have yet. We have to try and push and advocate for better data. Cost of mitigation is not linear. What that means is the big risks tend to be low cost to mitigate. But as I get to the smaller risks, it becomes more and more expensive to mitigate them. So I have to have a cutoff point. I have to bring this balance using the risk management approach. And we're going to do that with a simple matrix. So the cost of mitigation, as I get to less frequent risks, the cost of mitigation goes up. And I have to be able to define the area where I'm going to operate. What's the risk to accept? And what's the risk appetite? How much am I going to do? Well, if I'm in a country which has never had an earthquake, do I need to plan for an earthquake? If I'm in a country which has never had a volcano eruption, do I need to plan for a volcano eruption? Not a tolerable risk. But most countries have had flooding, countries have had fire, most countries have had other kind of disruptions, strikes, eco-disruptions. I do need to plan for those, and I need to look at the cost of mitigation of those risks. But again, it's a balance. Let me just put on life-saving medicines, because often people don't. And this is a simple calculation using a DALI, a disability adjusted life years calculation. So what's the risk of stock out of interruptions? If I'm out of stock of antiretrovirals, patients are more than twice as likely to die. Increase the rate of deaths 2 times. That's quite a big impact. If I compare the cost of having ARVs with the cost of not having ARVs. So the British Medical Journal calculated the cost of a patient death from not having ARVs was $28,038 for Africa. That's the cost because the patient suffers and there's a loss of income and loss of family support and everything else. Well, what's the cost of having ARVs? Well, a year's supply of ARVs is about $184. So having ARVs, $184, not ARVs, $28,000. That's a ratio 150 to 1. Excuse me a moment. Let me just have a... What does that mean? I could have 150 bottles of ARVs expire, and that's cheaper than having one patient die from being out of stock. 150-to-1 ratio, because it's a life-saving method. Now, when we talk about placing forward supplies and contingency supplies, that's the kind of calculation we need to explain to people. Oh, we've got stock. Yeah, we have, because it's cheaper to be prepared for contingency than have patients die. That's the reality. These costs are for low-income countries. So 150 to better to have 150 bottles on the shelf and risk expiry than risk out of stock and one patient dying. Why do we have so many risks? Well, because of cost efficiency instead of resilience. Italian proverb, buy cheap, buy twice. It's a Russian proverb, we are too poor to buy cheap medicine. We've been buying very low-cost medicine. They're reasonable quality, but the supply chain supplying them has not been resilient. It's been very fragile. A little bit of disruption. The ship is disrupted. The harbour unloading the ship is disrupted. The trucks deliver. It's coming massive distances. It's very easy to be disrupted and operate and producing stockouts. So we've got, because we have allowed efficiency to dominate resilience. So we're going to apply the risk management process now, this ISO process, to identify the risks, then analyze the risks and evaluate the risks. Step one, have you got a clear health policy? Most countries do. Have we got a clear PSM policy, written policy and guidance? National medicine policy, essential medicine list, diagnostics and equipment policy. All of that we need in place. Have we got sources of funding for our products? What are the available resources? What's my PSM data? How's the financial security? What's the overall situation in the country? We establish the context first. Are you in a conflict country? Are you in a country with problems? That's where we define the risk of the context we're operating in. Here is a UNDP risk assessment, an example. Have you got a procedure manual? Oh, high risk is no manual. Significant risk, you've got some procedures. Moderate risk, mostly okay. Low risk, yeah, I've got a full procedure manual, PSM. So already, just on the policies and procedures in place, I've already got a risk matrix, high to low. Are formal roles established? Do we know exactly who does what? Who does the procurement? Who does the warehouse? Who does the distribution? High risk, no formal agreements. Significant risk, allocated. Moderate risk, clear allocations. Low risk, yeah, it's all documented. Everybody knows who's doing which job. That's an example of the risk assessment. And you can all do that. You can all measure that. You can look at the manuals. You can look at the procedures you've got. You can fill in that kind of table. That's the kind of risk assessment that I'm talking about that we need to undertake. Step two, we identify the risks. We've got government policies. Maybe the government will only pay by letter of credit. Well, that's a risk because not all suppliers will accept it. It limits the number of suppliers I have. Have I got enough skilled staff? How is my monitoring of supplier performance? How is my information security? If I had a cyber attack, would I be okay? How is my process efficiency? Identifying where the risks are in my supply chain. And there's so many risks that usually I have to just group them together. There's just hundreds of risks, so I'm going to put the risks together in groups. And top trend to watch there are the you can group together. There can be internal risks and external risks. So internal within the supply chain, shortages, inaccurate forecasts, theft and losses. Maybe the patients don't accept what you're delivering, all kinds of risks there. Associated among stakeholders, maybe donors aren't going to stop funding you. Trade restrictions, patent laws, externals, supply chain, climate change, labor disputes, strikes, natural disasters, floods, armed conflicts, all those. So I group them together rather than making every single risk. Then I look at what drives the risks. Disruptions, well, natural disasters, labor disputes, strikes, supplier bankruptcy, war and terrorism in some areas, on delay, too high a capacity at the supply source, poor shipment, on forecasts, inaccurate forecasts and long lead times, bullwhip effects, and then I get too much. That's the bullwhip effect, moving backwards and forwards, exaggerating, de-exaggerating forecasts, lots of drivers of risks, lots of different categories of risks I need to consider. There are even more. What about intellectual property? Am I going to be a law? What about the exchange rate risk on procurement, on inventory, product obsolescence? I mean, WHO is always changing the TB treatment drugs. How am I going to keep pace with the new drugs and my holding of TB drugs and the costs of holding these TB drugs? Have I got enough capacity on? We've never got enough supply staff and enough trained supply staff in the system. Risks. Then I'm going to evaluate the risks, and I consider that in two parts. How likely is the risk, and what's the impact of the risk? Then I consider, can I control the risk? Is there anything I can do about it? Graded matrix using the Delphic method. And complicated, but it's actually very simple, as you'll see on the next slides. So, what's the likelihood of a risk occurring? Could be rare. Once every 7 years or more. Okay? May occur in exceptional, not very likely. Very likely twice a month. Might be that my trucks break down. How often do my delivery trucks break down? Oh, twice a month. That's a high risk. That's going to be a scale 5 because it's very likely to occur. How often is it I get very serious flooding in my country, which would disrupt distribution and perhaps damage my warehouse? Rare. It only happens once every 10 years. That would be a 1. And so they're graded through. And you make those decisions. That's the Delphic method. You assemble a team together, 4 or 5 people, and they give their best advice for each risk. How likely is an earthquake, a volcano? How likely is another pandemic? How likely is truck breakdown, warehouse striking staff, economic sanctions, economic disruptions, exchange rate risks? How likely is each of them? And put a number against them on this scale. How likely is it to? Simple enough to do, just takes a few days of a group of people to do that. Then I look at the impact of the risk. What's the consequence of risk occurring? Well, I might be out of stock for a day. A day out of stock, it's not a big problem. It would be a 1. If I was out of stock for more than a month, that would be an extreme problem. That's irreparable damage. People are going to be threatened. Their life is going to be threatened on the life-saving drugs if I'm out of stock for a month. And then grade in between. So look at the impact of the risk. What's the impact of disruption to paracetamol? That doesn't really matter. What's the impact of reduction to ARVs? If I was out of stock for a month of ARVs, people are going to die. Recognize the impact. And again, you make this table. Using your best knowledge, you put a team together, the Delphic committee, 4 or 5 people, and they use their inputs and scale and score according to this matrix. Now I put the two matrices together. Down the left-hand side in the light blue, hood, in the yellow across the top, consequences. And I put them together to get the risk. So if it's very likely to occur, 5, but it's insignificant, I only score a 5. Not to worry. If it's very likely to occur and a major consequence, it scores 25. That's in the red. That's really serious. Can you see now the red and the orange and the blue and the green? If significant, it's a low risk, it only scores 1. If it's very likely major impact, it scores 25. So a simple scoring of 1 to 25 to identify, evaluate the risks. So what do I need to do? If 20 or 25, I've got to act. I must do something to mitigate, to reduce the risk or reduce its impact. High, so I take activity, and I've got to monitor that risk constantly. I need to look at it. I need to mitigate the risk. Below 5, you to look at it, but it's not that serious. It can wait when I get to it. So now I've got a systematic way to respond to the risk, identifying the high risk, moving to address the high risk item. How much control? And again, we score the control 1 to 5. So if you've got no control at all, it's 1. You've got no control on earthquakes, on volcanoes, not flooding. If you've got complete control, then it's a 5. And I score 1 to 5 on the control index using the Delphic system again. How do I score it? Well, security impacts. Are you going to have elections in your country? When there's elections, there's often security disruption. There's disruption to distribution. That's quite a high risk level. That's a political risk. Lack of funding. You've never got enough money for all the medicines and products you need. So that's generally a high risk. Delays in program. Yeah, that's high risk. Look at the risk and look at the degree of control that you have. Can you control the elections? I hope not. No. Can you control the lack of funding? Usually not. So they're not risk control. What does this mean? Focus on the high risk areas. It's not important if you're out of stock of paracetamol for a few days. It is important if you're out of stock of TB drugs. In the bottom is the example of the Philippines. They were out of stock of TB drugs for a month. Around 2,600 patients didn't get their TB. Some of them died, but the ones that didn't die infected other people, and they died. And they infected people with MDR TB because they interrupted their halfway through. So now they've not just got TB, they've got MDR TB, other people. So in total, for this stock out of 1 month of TB drugs, around 600 patients, 588 died. That's the example from the Philippines. That's the kind of impact that can happen. So when people talk about not placing the supplies, not having contingencies, not planning, this is what happens when you don't have risk management, when you don't have planning. Out of stock for 1 month, people died. So what's your risk management policy? Do you need to try and address every risk? You can't. You're going to have to look at the risk. You're going to have to tolerate the risk. You can't do anything about earthquakes and volcanoes. You can make their impact, but you can't stop them occurring. I can mitigate the risk. I can transfer the risk. I can help to close down the risk. Look at what I can do, the risk, and what I can do to reduce the impact. the consequences of the risk. Two parts. I cannot control every risk, but I can mitigate the impact on every risk. Why do you tolerate? Well, sometimes there's just no way to do it. Sometimes it's just too expensive to do that. Point about tolerating risk, it has to be a deliberate decision, not just, oh, we're doing nothing. Mitigate the situation by focusing on contingency plans, having contingency plans ready. Reduce the risk. How can I reduce the risk? Well, if you procure everything from one supplier, that's high risk. If I were to split the tenders 80-20, or perhaps for life-saving vital medicines, even 60-20-20. So 80% to one supplier, 20% to another supplier. If one supplier fails, I can still get some product from the other supplier. That's one way to reduce the risk. I identify the risk, potential disruption, and then I look at addressing the risk. Again, buffer stocks, I don't need the same level of buffer for every item. And yet many warehouses, many stores do exactly, oh, we have 6-month buffer stock. Why? Why are you keeping 6-month buffer of paracetamol? What's the risk of a disruption on paracetamol? I do need to keep 6 months of ARVs and TB medicines. Look according to the risk, measure the risk. Distribution, alternative distribution mechanisms in place, ready. Cyber risk, what would happen if you had a virus and all your data was lost? How would you recover? How would you respond? Are you taking adequate cyber security precautions? Transfer and hedging risk is usually around foreign currency, cost stable. We can place conditions that suppliers must keep 3-month stock. If I'm using local suppliers, placing orders through local agents, have a condition that they must keep 3-month stock in the country. Pay the supplier to hold strategic stocks. Consider 80-120 contracts instead of just fixed quantity. I want to order this amount, 80% up to 120%. In the risk, transfer in the risk, having contingency contracts, supply in case of emergencies, agree product sharing with the private sector. They often have supplies. If I'm out of stock, can I borrow supplies from the private sector? And taking insurance for failures. Design the supply chain network. Clear chain of command, sharing information. No more silos. Procurement information is available. Information is available. Select medicines with supply chain risks. If I've got a very special requirement, that's a huge supply chain risk. Reduce that. Try and use standard essential medicines. Treating risk, control the risk, identify the risk, reduce the impact of the risk. So even if I can't control the risk, I can reduce the impact. And that means that I've got good information available, so I know what the impact is. Establish a risk management team for PSM, evaluate the risk, look at what the risks are, look at the alternatives to the risk, and develop a contingency plan. Okay. We have time for the second QA session. I rushed through that quite heavily because of the time. Okay, we have 15 minutes for Q&A. Let's see what is in the chat box, if anything. Is there any reason why one is the capital of APIs? Just because that's where they started, yes. Yes, PowerPoint is always shared with everyone. Is there a method to determine the number of staff needed to implement or reduce risk management? Find it in the JSI manual on human resources. Gives you the staff. Yeah. Okay, so new messages. So implement or reduce risk management. So implement risk management, yes. You can look at the number of staff involved. There's been a big human resource, and you also find it in the human section of the course.
Sorry, Prof, can you just address the manual? I didn't hear the name of the manual for the staff.
The JSI Human Resources Manual. Yeah.
Okay, thank you.
And it's the core competency framework. And you'll find risk management staff included in the core competency framework. Okay, if you want to email me, I'll send you the link.
Thank you. Wonderful, thank you.
In a country with a crisis like a civil war, are restricting the importation of medicines not to supply the organizations fighting against them and also the community supporting them. Even humanitarian assistance are not allowed for importation. Is it a war crime or a crime against humanity? I think war has to be declared for it to be a war crime. It's certainly a crime against humanity. Some people think that it's, okay, let's go back there. It's certainly a crime against humanity, yes. How can the private sector to reduce the national, sorry, I can't just read that. The national risk, okay. By interacting with them, by cooperating and coordinating with them, sharing product, having mechanisms in place which allow you to share the product between public and private sector. I think we could probably do it by analyzing the cost of stock availability versus stock out of non-essential medicine. I've given you two examples. One was the Philippines, the other was the ARVs. There's a system called Quali-Dallies. Qualis are very common. You don't need to use them directly, just use the results. What's the cost? What's the cost of failure to treat because of a stock out? And that normally gives us a ratio of better than 100 on life-saving medicines. So availability is important. The classic I always quote is anti-venom. Snake anti-venom, you have to have it there. You can't say to a father, your child must die because I was afraid of expiry, so I didn't order any. It's there. We know it's going to expire. We want it to expire. We keep strategic stocks. They're going to expire. I want them to expire because they're there in case of an epidemic, in case of an emergency. If I don't have it, that's a cost. And we have to recognize that cost. And we do that in the Dallies system of stock availability versus the impact of not. And we certainly saw that impact during COVID. Okay. If anyone wants to unmute and ask a question directly, that's fine. Otherwise, please type in the chat box. Yes, Mesfin, please go ahead, unmute and ask a question.
Thank you very much, Prof. I think this is excellent presentation and explanation. Just from my country perspective, yes, this mitigation methods or risk management can help to reduce those stock out and related issues. But this is usually more practical when natural disasters is occurring. It can be treated with the support of by the capacity of the country or sometimes with external support. But as my colleague asked in the previous chat, with the chat, I think especially when there is a political issue and a country or a region may be ignored, or there will be restrictions to move there. Whatever the system is there, but if the political power does not allow to accept, well, how can we reduce this risk? Because yes, it's declared, but sometimes may not be accepted by the local government to accept. Thank you.
Right. All is to advocate, to explain to people. They may not accept what we say. That's their prerogative. But we have to try and advocate and explain about risk management and what we need to do. Often we have limited resources, so we have to work within those resources. And that means it's to how much we can be prepared. But we have to explain the consequences of not having contingency, of not being prepared, of not adopting these mechanisms. That's our role. In an ideal world, everyone would accept what we say. They rarely do. All we can do is continue I've been trying for more than 30 years. People run away from me when they see me in every ministry in the world because they know I'm going to be advocate for this kind of activity. But yes, all we can do is push and push. Be prepared to explain in simple, easy terms, like these matrix, what we can do to mitigate the risk. Nobody ever wants to spend money. We have to push for that and make them understand what are the consequences of not implementing this. What are the consequences of not being prepared? Okay, Josephat, I see you've got your hand raised. If you would like to unmute and ask a question.
Yes, Prof. Thank you for this session. I came in a bit late, but my question is more on the avoidance, but first the risk and also the avoidance of these expiries. Some organizations are already doing virtual preposition stocks against having physical stocks, but they still take the same strategic view that you mentioned, that they check on them more often. What can you talk to around this strategy? But this is more to an NGO I work with.
Yeah, that's fine. I mean, there are many strategies for risk mitigation, for reducing the impact. Virtual stocks are helpful because it helps you plan. It helps you to mobilize if you know what you want. There's an earthquake. You don't need to be starting at the beginning of what do we want. There are earthquake kits available. There are disaster kits available. All the content out. We should have that ready. That's the advantage of the virtual stocks. I know exactly what I want and where it needs to go. It's not the same as having it, but at least I've got it ready to move to where it goes. And that is all a step forward. It's a step in the right direction. We beyond that into physically holding. If there's good communications, if there's good transport, then I can keep them remotely. Increasingly, regional stocks, multi-country stocks are being advocated. That can work in areas where there is good transportation. Not always applies to everywhere. And often if there's a natural disaster, no transportation. So it's difficult to get supplies there. That's why pre-positioning contingencies are helpful and useful. But just like my example of Indonesia, they're set up, they're ready for it, they go. They treat it as a normal condition because they're in a geologically active area. That's what happens when you live there. But mitigating the risk, having it ready, virtually a good step, but move to physical stocks when you can. Hope that answered it. Okay. If there are any more questions, please unmute or raise your hand and we'll come to you. Okay, Josephat, again, you've got your hand up. Okay, you've given me the thumbs up. Okay, right. Okay, well, good. you have any questions, type them in the chat box or unmute, please. Go ahead. Yeah, Nadira, I see you're unmuted. Do you wish to ask a question? Kudakwasi, you're unmuted as well. Do you wish to ask a question? Okay, then Priya, I think meeting for now, and we'll, as usual.
Thank you. Thank you. The same share with you. And if you have any further questions related to this topic, please feel free to email me. I will forward it to you. Is that okay, sir?
Fine. Bye to all.
Thank you so much, sir. Thank you so much. Means a lot.
No problem.
Bye.
Bye. Thank you.
Bye for now.